Hello, young anatomists. This video is meant to give you an overview of the male reproductive system. We'll cover the essentials with a focus on how male reproductive structures are suited for their function. And I'll also cover a few things that you might have heard about or afraid to ask, but now you can understand with some anatomy and physiology expertise. Let's get started. The overall function of the male reproductive system revolves around sperm cells. Make the sperm, store the sperm until the time is right, and then release the sperm for a chance at making a baby. Reproductive organs can be classified as essential organs or accessory organs. Essential organs are in charge of making gametes. Those are the sperm cells or the egg cells. And accessory organs, on the other hand, just support gamete production and also the fertilization process. It might come as a surprise, but in males, the only essential reproductive organ is the testes. The testes not only produce sperm, but make testosterone as well. Now, the fancy name for making sperm is spermatogenesis. Man, that's a big, long word. Spermatogenesis is what's happening inside of these pink circles. Now, between the pink circles, there are these other cells called interstitial cells. Interstitial cells are the ones that make testosterone, the male hormone. Now, those pink circles are actually called seminiferous tubules, and this is just a zoomed-in view of one seminiferous tubule. Now, the most immature cells are called spermatogonia, and spermatogonia are on the outside, and when spermatogonia divide, they push their daughter cells inward, and as those cells move towards the lumen, or middle of the seminiferous tubule, the cells undergo changes and differentiate or mature into mature sperm cells. Now, this zoomed out view shows that there are many seminiferous tubules in each testis, and all of those seminiferous tubules would make their sperm, and those mature sperm cells would go right to this spot in the testes. Now, sperm cells are some of the most fascinating cells specialized for their job. And remember, the job of a sperm cell is to fertilize an egg. Now, the head of a sperm cell has a nucleus that contains the father's DNA. And the goal is to join this father's DNA with the mother's DNA in the egg during fertilization. And in addition to the nucleus, the sperm head has a capsule of enzymes called the acrosome. When the sperm cell touches an egg cell, there are enzymes in the acrosome that are released to help the sperm cell get into the egg for fertilization. Another important part of a sperm cell is the midpiece. That's shown right here. The midpiece is kind of like a gas tank for the sperm cell. The midpiece is jam-packed with mitochondria to make ATP that allow the tail to move. And finally, the tail is like a propeller. Technically, the sperm tail is called a flagellum, and when the tail is activated, the tail moves around to help the sperm swim in the direction towards the egg. Now, let's take a look at those accessory organs to see how accessory organs help sperm cells. Accessory organs can be further classified into ducts, glands, and supporting structures. Let's start with ducts. There are 4 ducts that we need to keep track of: the epididymis, the ductus deferens or vas deferens, ejaculatory duct, and urethra. To make these ducts easy to see, I've color-coded them with their name and their anatomical location. You should do it too, so you understand the boundaries for each. Now remember, the sperm are made in the testes, which are right here. Then the sperm go to the epididymis in red that lays along the superior and posterior parts of the testis. A sperm would stay in the testis and epididymis until ejaculation, and then during ejaculation, muscular contractions move the sperm up and around the bladder using this green ductus deferens, and then this short blue duct is called the ejaculatory duct, and finally the orange urethra that leads to the outside of the penis. And some of these ducts have specialized functions, so let's take a closer look. First, the epididymis. The epididymis kind of looks like a comma behind the testes. Besides just being a pathway out, the epididymis is a place where sperm spend a week or 2 for their final maturation. And in addition, sperm can be stored in the epididymis for about a month. Now, if the sperm cells aren't used, they're broken down and replaced by fresh sperm cells, so you can only have the freshest sperm whenever there's a chance for a pregnancy. Overall, the epididymis only secretes a small part to the final seminal fluid, which that's the fluid that's ejaculated from the penis that contains sperm cells. I just want to take a look at the ductus deferens because this is what's cut when men get a vasectomy. Vasectomy is a short surgical procedure that's meant to sterilize men if they no longer want to have children. The surgery is called a vasectomy because a more common name for the ductus deferens used to be the vas deferens. And a vasectomy is an outpatient procedure that can be done in less than an hour, followed by some ice and resting. And as you can see, by cutting the ductus deferens right here, so they take it out and they cut it and they put it back in, now there's no longer a pathway for the sperm to get out from the testes and epididymis to the rest. That pathway is just cut off. So what will happen to the amount of semen? Let's hold that question until later. Overall, the ejaculatory duct is pretty boring, and let's just think of it as a short tube that helps form the pathway out. But the urethra is kind of interesting. It's the last tube on the way out, and in males, the urethra is part of the reproductive system and urinary system. You can see here's the urethra. The urethra connects to the bladder, that's up here, and we've already seen how the urethra takes semen from the ejaculatory ducts, which are here, to the outside of the penis. Next are the accessory glands. I want you to keep track of 3 accessory glands. That's the seminal vesicles, the prostate gland, and the bulbourethral glands. Again, here's where those structures are color-coded. Add these colors to your diagram. The seminal vesicles are pouches that are indicated by this red arrow that are tucked behind and underneath the bladder. That's right here. The prostate is all this yellow stuff. Some people say it looks like a walnut with tubes running through it. And the bulbourethral glands are pointed out with this blue arrow here, and they're connected directly to the urethra. Kind of like bulbs, like the things you squeeze on the end of the pipette. Now, let's talk about what each gland does. If you look at the inside anatomy of the seminal vesicles, you'll notice that there are a lot of convolutions or twists and turns or mini pockets inside of there. And the goal of that type of theme in anatomy and physiology is to increase surface area. Now, the main job of seminal vesicles is to add secretions to the semen that contain fructose and prostaglandins. Fructose is a sugar, and fructose provides fuel for the mitochondria in the sperm cell's midpiece to make ATP and power that sperm cell tail so the sperm can move. Now, prostaglandins are signaling molecules. What's interesting about prostaglandins is once they get into the female reproductive tract, the prostaglandins can cause muscular contractions to help move that semen and the sperm cells deeper into the female reproductive tract to increase the chance for a pregnancy. Moving along from the seminal vesicles is the prostate gland right here. The prostate gland is kind of a donut shaped, and that's because, like a donut, there's a hole in the middle, and that hole in the middle is caused by the urethra passing through the prostate. The prostate gland contributes other valuable secretions to the semen. First is citrate. Like fructose, citrate is a nutrient that sperm cells can digest using cellular respiration to give them energy. And second is an enzyme called PSA, which stands for prostate-specific antigen. PSA helps semen stay more liquidy, and that way it's easier for the sperm cells to swim through liquidy semen rather than semen that's really viscous or really thick. The prostate gland is infamous for the problems that it causes, most commonly enlarged prostate. Enlarged prostate is also known as BPH, or benign prostate hyperplasia. Benign means that it's not life-threatening, prostate means it has to do with the prostate, and a hyperplasia just means like getting bigger by making more cells. Now, this is very common in older men, and if you look at the diagram here, here's a normal prostate, and here's the enlarged prostate, you can see why an enlarged prostate is a problem. Once the prostate gets enlarged, it pinches off the urethra. Look at how open the urethra is here versus here and here. Now, this makes it really hard to urinate. So men with enlarged prostates feel the urge to urinate a lot more frequently, but a lot of times when they get to the toilet, they can't go very much. Now, the good news is that enlarged prostate can be fixed. The cure would be a surgery called a TURP, which stands for transurethral resection of the prostate. Now, if you use the information in those words, you can guess that this means that a doctor puts surgical instruments in through the urethra, so in through the opening of the penis, moves those surgical instruments up to where they need to go in the prostate, goes through the urethra to start trimming away the enlarged prostate, and then has to pull those chunks out the same way. This procedure is painful to imagine, but a lot less riskier than other surgical options. Before surgery, though, a doctor would probably try a drug treatment like Flomax. So how Flomax works is it blocks neurotransmitter receptors in the smooth muscle of the bladder and prostate to try to open this urethra up as much as possible to let out more urine and get better urine flow to maximize the flow. Benign prostate hyperplasia can sometimes turn into prostate cancer if it's not monitored. About 1 in 6 men in America get prostate cancer, and it causes significant death. And a frustrating part of these deaths is that prostate cancer is preventable if detected early. And checking the prostate is an easy but awkward procedure. The most common prostate test is called the digital rectal exam. And I'm not talking digital like some fancy technology. I'm talking about digital like this finger right here, this digit. So this is the infamous like snapping of the rubber glove procedure from the movies. A doctor sticks their finger, their digit, into the rectum and feels the prostate through the rectal wall. So you can see how close that is right there. And if the prostate feels bumpy and irregular like this one, that's a bad sign that the prostate is likely cancerous and has some growths, some tumors on it. The good news is that there's a blood test that's becoming more common to measure the amount of PSA enzymes in the blood instead of going through this. But this is still like very easy and very quick procedure. And if you have a loved one that's a male over the age of 50, encourage them to get tested regularly. You may save their life. Our final accessory glands are the bulbourethral glands. You can see that they're paired structures right here on either side of the urethra, and they're about the size of a pea. The secretions of the bulbourethral glands are also called the pre-ejaculatory fluids. Now, this fluid flushes out and neutralizes the pH of any residual urine in the urethra, as well as lubricates the urethra, so any sperm cells that are coming out through all of this tubes didn't go that long journey just to get stuck on their way out. To review the accessory glands, let's take a look at the composition of semen. The total amount of semen per male ejaculation is about 1.5 to 5 milliliters. Now, this whole pie chart adds up to 100%. The seminal vesicles contribute 64% of the volume of ejaculatory fluid, which is most of the semen. Next, the prostate gland gives about 24% of the fluids, and the bulbourethral glands contribute a minor 4%. Now, the testes, which are not an accessory gland, contribute 8%. Now, the reason I bring this up is because we were talking about vasectomies before. So, can a man that's had a vasectomy still ejaculate? Remember, a vasectomy just separates the testes from the rest of the reproductive system, so everything is working okay. So, a man that has a vasectomy still does ejaculate, just without the 8% of seminal fluid that would come from the testes. The last two structures are the scrotum and the penis. They're considered accessory organs under the subclassification of supporting structures. The scrotum is a skin-covered pouch that holds the testes, as shown right here, and besides forming a protective covering for the testes, the scrotum helps regulate the temperature of the testes. The reason why that's important is because there is an optimal temperature for making sperm and storing sperm cells too. Now, there's two muscles that help with this process, the dartos muscle and the cremaster muscle. The cremaster muscle that's shown here in red, and it's on both sides, so there's both testes. The cremaster muscle contracts when it's cold outside, making this shorter and bringing the testes closer to the body. And then when the body's too hot, the cremaster relaxes, allowing the testes to hang outside more and cool down. The dartos helps by keeping the scrotum tight, against the testes. So that's what's shown here as this red layer. The dartos contracts when it's cold to have the scrotum shrivel up and bring the testes close to the body, warming the testes to their optimal temperature. But when it's warm in the body, the dartos relaxes to let the testes cool down away from the body. The last structure is the penis. The penis is kind of just like a urethra holder, helping urine and semen get outside. The specialization of the penis for reproduction, however, is that the penis has erectile tissue. That's shown in here. It kind of looks like a little face or something. And that becomes erect during sexual intercourse to help deliver semen into the vagina. Some other anatomy of the penis includes the glans penis, which is the distal end or head of the penis. And not shown in here is the prepuce or foreskin, which covers the glans penis when the penis is flaccid or not erect. The prepuce or foreskin is controversial because of circumcision. You can see a penis here with an intact foreskin or prepuce. That's an uncircumcised penis, natural. And here is a circumcised penis where parents have chosen to have the foreskin removed from the penis. So circumcision, just to be clear, is a surgical removal of the foreskin. A circumcision is often done right after birth while the baby boy is still in the hospital or when a male is still very young, and it's the decision of the parents. And the reason that it's controversial is because there's arguments for or against circumcision depending on who you talk to. Some people argue that circumcision makes cleanliness down there more hygienic and that it could potentially decrease the incidence of urinary tract infections or sexually transmitted infections, and also penile cancer. And some of these arguments are very controversial and not very well supported by science. Other arguments against circumcision is that it's obviously very painful and uncomfortable for the young boy, and there can be complications during surgery like skin healing and fusing with other parts down there, forming what are called skin bridges, or having too little of the foreskin removed by accident or too much removed by accident. And then finally, there's decreased sexual stimulation in adult men without a foreskin. But perhaps the biggest argument against is the risk, albeit a small one, of death from circumcision, where there are about 117 deaths per year due to circumcision complications. As a parent, you might have to make this decision one day, so it's a good thing to think about. The last thing that I want to talk about are the specialized erectile tissues in the penis, and there are 3 bodies of erectile tissues in the penis. 1, 2, 3. So these two on the left and right are called the corpora cavernosa, or you could call one a corpus cavernosum, and the one on the ventral or inferior side here is the corpus spongiosum. So that just means like body. So it's like the cavernous body or the spongy body. And you could see the urethra right here in the corpus spongiosum, and then the deep penile arteries in the corpora cavernosa. And it's actually the anatomical position and blood flow through these blood vessels that cause erection. Let's check that out. So sexual stimulation causes vasodilation of these penile arteries. So that means that blood is flowing into the penis and filling up these erectile tissues. And when that happens and these erectile tissues become filled with blood, it pushes this tissue up. And you can see that here are the penile veins. So when the tissue comes filled with blood, it pushes these veins against the top of the penis and kind of like cuts off blood flow going out. And that's how the penis stays erect. After ejaculation, then more blood flow can flow out of the penis and the penis returns to its flaccid state. All right, well, that's it. I hope this video provided you with a framework to better understand the male reproductive system, and armed with some good information, you can understand some common misconceptions out there that people are often weirded out by talking about it.